Should I get this atypical mole checked for skin cancer? Imagine noticing a mole on your skin that looks a little different from the rest. Maybe it has uneven borders, a mix of colors, or it's changing shape. These signs can be more than just a cosmetic concern. An atypical mole, also called a dysplastic nevus, is not cancer itself but is considered a risk factor for developing melanoma, a serious type of skin cancer. While most atypical moles do not turn into melanoma, having them increases your overall risk, especially if you have many or other risk factors. Atypical moles often look irregular. They might have jagged or scalloped edges, multiple shades of brown, black, or even red and white, and they can be asymmetrical. They can appear anywhere on your body, including areas not usually exposed to the sun. If you notice a mole that looks different from your other moles, or if it has changed over time, it's important to get it checked by a dermatologist. Having 10 or more atypical moles can increase your risk of melanoma by up to 12 times compared to someone without them. Other factors that raise your risk include having fair skin, light-colored eyes or hair, a history of frequent sunburns, or high sun exposure over your lifetime. A personal or family history of melanoma or other skin cancers also raises your concern. If you have these risk factors, regular skin exams become even more important. Dermatologists often use the absidy rule to evaluate moles. Look for asymmetry where one half doesn't match the other. Check the borders. Irregular, scalloped, or poorly defined edges are warning signs. Notice the color. Multiple shades or unusual colors can be suspicious. Measure the diameter. If it's larger than 6 millimeters, about the size of a pencil eraser, it warrants attention, though melanomas can be smaller. Finally, observe if the mole is evolving, changing in size, shape, color, or if it starts to itch or bleed. Any of these signs should prompt a visit to your healthcare provider. If your dermatologist finds a mole that looks suspicious, they may perform a biopsy. This involves removing a small sample of tissue to examine it under a microscope. This step helps determine if the mole is benign or if it needs further treatment. Remember, early detection of melanoma is crucial because it is the deadliest form of skin cancer but also highly treatable when caught early. Regular self-examinations are a good habit. Keep track of your moles, note any changes, and report them to your doctor. Protecting your skin from the sun is also vital. Use broad-spectrum sunscreen, wear protective clothing, and avoid peak sun hours to reduce your risk of developing new atypical moles or melanoma. In conclusion, if you have an atypical mole, especially if it's new, changing, or if you have other risk factors, it's wise to have it checked by a dermatologist. Early evaluation and ongoing monitoring are your best tools for maintaining healthy skin and preventing skin cancer. Always seek professional medical advice for any skin changes that concern you.